I'm Dr. James, and welcome back to Pancreatic Cancer Warriors. Most people think pancreatic cancer only affects older adults, but today we're going to talk about a crucial topic that doesn't get enough attention: pancreatic cancer in young adults. While it's true that pancreatic cancer is rare in younger individuals, it's important to understand that it can and does occur. The majority of cases are diagnosed in people over 60, but that doesn't mean younger adults are immune. In fact, recent studies have shown a concerning trend of increasing rates among those under 50. So, why do we often overlook the possibility of pancreatic cancer in young adults? Part of the reason is its rarity. Doctors are trained to look for more common explanations first, especially in younger patients. This can sometimes lead to delayed diagnoses or misdiagnoses of symptoms. But here's the thing: being aware of the possibility is crucial. While we don't want to cause unnecessary fear, understanding the risk factors and symptoms can make a significant difference in early detection and treatment outcomes. Let's talk about some of the risk factors that might apply to young adults. Family history is a big one. If you have a close relative who's had pancreatic cancer, your risk is higher, regardless of your age. Genetic mutations, like BRCA1 and BRCA2, which are often associated with breast and ovarian cancer, can also increase your risk of pancreatic cancer. Lifestyle factors play a role too. Smoking, heavy alcohol use, and obesity are all linked to increased pancreatic cancer risk. These are factors that can affect people of any age, but they're particularly important for young adults to be aware of. Now, let's address why symptoms in young people may be dismissed or misdiagnosed. Many of the early signs of pancreatic cancer can be vague and easily attributed to other, more common conditions. Abdominal pain, back pain, unexplained weight loss, and digestive issues are all symptoms that could be caused by a variety of things. In younger patients, doctors might first consider conditions like irritable bowel syndrome, gallbladder issues, or even stress-related symptoms. This is understandable, given how rare pancreatic cancer is in this age group. However, it's crucial that both patients and healthcare providers remain open to less common explanations. If symptoms persist or worsen, if you're a young adult experiencing persistent symptoms, don't ignore them. Trust your instincts. You know your body better than anyone else. If something doesn't feel right, or if symptoms are lingering longer than you'd expect, it's important to speak up and seek medical attention. Here's what I want you to remember: being young doesn't make you immune to pancreatic cancer. While it's rare, it's not impossible. Awareness is your best defense. Pay attention to your body, know your family history, and make healthy lifestyle choices. It's also important to advocate for yourself in medical settings. If you're concerned about persistent symptoms, don't be afraid to ask your doctor about pancreatic cancer. A good healthcare provider will take your concerns seriously and be willing to investigate further if needed. Let's talk about some specific symptoms to watch out for. Jaundice, which causes yellowing of the skin and eyes, can be a sign of pancreatic cancer, even in young adults. Unexplained weight loss, especially if it's rapid, is another red flag. Changes in stool color or consistency, particularly if stools become pale or oily, can also be a warning sign. Persistent fatigue, loss of appetite, and nausea are other symptoms that shouldn't be ignored, especially if they're accompanied by abdominal or back pain. While these symptoms can be caused by many other conditions, if they persist or worsen, it's worth discussing with your doctor. Now, I want to emphasize something important. Experiencing these symptoms doesn't necessarily mean you have pancreatic cancer. In fact, it's much more likely that they're caused by something else. But being aware and proactive can make a huge difference if it does turn out to be something serious. Early detection is crucial with pancreatic cancer. The earlier it's caught, the more treatment options are available, and the better the outcomes tend to be. This is true for patients of all ages, but it's particularly important for younger adults who might otherwise be diagnosed at a later stage due to the assumption that they are too young for pancreatic cancer. Let's also talk about the importance of knowing your family history. If you have a close relative who's had pancreatic cancer, or if there's a history of genetic mutations in your family that increase cancer risk, it's important to share this information with your doctor. They may recommend earlier or more frequent screenings, or even genetic testing in some cases. For young adults with a known increased risk, there are screening options available. These might include regular imaging tests like Mr. IS or endoscopic ultrasounds. While these are untypically recommended for the general population due to the rarity of pancreatic cancer in young adults, they can be valuable tools for those at higher risk. It's also worth mentioning that some of the risk factors for pancreatic cancer are modifiable. Quitting smoking, maintaining a healthy weight, limiting alcohol consumption, and eating a balanced diet rich in fruits and vegetables can all help reduce your risk. These are good habits to develop at any age, but starting young can have long-term benefits for your overall health, not just in terms of pancreatic cancer risk. Now, I know that talking about cancer, especially a type that's as serious as pancreatic cancer, can be scary, but knowledge is power. By being aware and proactive, you're taking control of your health. Remember, the vast majority of young adults will never develop pancreatic cancer, but for those who do, early detection can make all the difference. I want to encourage all of you, regardless of your age, to listen to your body. If something doesn't feel right, don't hesitate to seek medical advice. Your concerns are valid, and you deserve to have them taken seriously. In conclusion, while pancreatic cancer is rare in young adults, it's not impossible. Being aware of the risk factors and symptoms, knowing your family history, and making healthy lifestyle choices are all important steps you can take. If you're experiencing persistent symptoms that concern you, don't ignore them. Consult with healthcare professionals and advocate for your health. Remember, you are your own best advocate. Trust your instincts, stay informed, and don't be afraid to speak up about your health concerns. By staying vigilant and proactive, we can work together to improve outcomes for all pancreatic cancer patients, regardless of age. Thank you for joining me today on Pancreatic Cancer Warriors. Stay informed, stay healthy, and remember, your health matters at every age.